BTK inhibitors are in the horizon, those drugs more close to the future entering of the market. It could be not so soon, but not so far. So the profile of this class of drugs is interesting because this is a type of drug that target both the innate immunity and the acquired immunity. And that's a characteristic that is very important, particularly when we think about what we said at the beginning of this interview. So if the disease has in common for a long time the presence of mechanisms acting in the relapsing remitting phase and mechanisms that are acting as a progression, then we should have drugs that potentially may target both to be used very early again. And these drugs, they have such a type of profile. So for this reason, they can be of importance from this point of view. And also, they can be also considered in the so-called de-escalation process, because some of the very powerful drugs, those that really aims to reshape the immune system, this class of drugs can be used only for a limited period of time. So what to do when we have reached this limit of time? We have to, sometimes we may just wait and see without treatment, but it's clear that if we have treatments that are able to have some persistent effect, de-risking in terms of adverse effects, then we may better protect the patient from disease reactivation when we discontinue these very strong drugs. And again, the BTK inhibitors may also see a possible type of use in this type of condition as a de-escalating therapy.